Hi everyone, welcome back to another episode of Path on the Street. My name's Beth, and today I'm back on North Campus asking Michigan students questions about pathology. Do you know what pathology is?
No.
Not really. I mean, a little bit, not really.
I'm thinking of like speech pathology.
It's like the study of like gods and like just like kind of like religions.
Like infections and stuff?
Yeah.
Diseases.
The study of diseases?
That's exactly right. Pathologists study disease.
Yep.
Do you think they spend most of their time interacting with patients or working in a lab?
Probably working in a lab.
Probably working in a lab.
I feel like it could entail both, but I would assume that it is kind of lab heavy.
I think some of them research and some of them actually interact with the patients.
Yeah, that's exactly right. Lots of them, they do a lot of research, and then some of them can specialize in like breast pathology, gynecologic pathology, and interact with patients a lot. What do you think it means to sign out a case?
I think that means that either like a plan or a diagnosis has been made.
I would assume it has something to do with outpatient care.
Maybe it's like either we can't find a cure to the disease yet, or we successfully find one.
Like to be done with it.
Signing out a case is basically like the finalization of a case. Pathologists, they'll look over all the information, they'll do their tests, and then they say, here's the diagnosis.
Cool.
About what percentage of diagnoses in a hospital are supported by pathologist research?
40,
40?
50.
60.
I guess 50%.
Or like give it 30%.
I think pathology is like the more advanced one, so maybe like 20 to 30%.
I'll just be like 70%. Really? Wow.
It's 70%. So which of these do you think is not considered a pathology test?
Okay.
A blood test, a cholesterol test, or a biopsy?
A cholesterol test.
Cholesterol test.
I would guess blood test.
Blood test.
Actually, all three of them are pathology tests.
Okay.
And pathology tests also include like strep throat tests, all sorts of things.
Yeah.
Pathologists are often called a doctor's doctor. Do you know why that is?
They cure cancer.
Maybe doctor will determine treatment plan, but they maybe need help to diagnose first, so perhaps that.
I don't know. I mean, I guess because they're probably like sort of teaching like a different things to a doctor that isn't in their normal like practice. So, you know, it's kind of like another resource for, I mean, this is just sort of my best guess, like just another resource for a doctor to kind of like identify, you know, like certain diseases, as you were saying, like if that's not like a doctor's main study, like in gynecology, like this is sort of a way for them to maybe get like a better understanding or sense, because that's what they specialize in.
Is exactly
That's
right.
my guess, yeah.
That's exactly right. Great answer. Yeah. If a doctor has a question, they say, hey, I need some help. They send it off to a pathologist and they can help them out. How many different subspecialties of pathology do you think are offered here at U of M?
Oh, a lot. I want to say like at least 50.
2, 4.
6.
12.
I feel like that's a lot. 8.
I think there's a lot since there's a lot of disease.
It's 19. Yeah, there are 19 pathology fellowships here at U of M. Thank you guys for watching another episode of Path on the Street. Hope you learned something new today. See you next time.